afternoon, Miss. I am Angelica Villario Sarsa from BSN 2B3, and today I'll be performing the assessing the delivery. So first is we need to perform hand washing or hand hygiene and then non-open gloving. This is to ensure that our hands are clean before doing the procedure and to maintain sterility.
Kung ang may car, nalasan, regular ito siya. Rapid, disco,
After that is we're going to prepare the instrument in order, starting from the right to the left. So first is we have the bandage scissor or surgical scissor. Next is the curve first step and the straight first step. This is used for clumping the umbilical cord, and the bandage scissor is used for episiotomy. Episiotomy, it is the surgical cutting of the perineum. And take note that we do not have to use the surgical scissor after episiotomy. Next is we have another surgical scissor. This is used for cord cutting and also episiotomy. Episiotomy, it is the surgical repair of the episiotomy or the perineal cut. Next is the needle holder. Needle holder is used to hold needles, especially during stitching. Next is we have the tissue forceps. Tissue forceps is used to hold tissues or skin while suturing. And then we have the syringe. Syringe is used for anesthesia. Anesthesia in delivery is used in relieving the pain during episiotomy or episiotomy on childbirth. Then we have suture. Suture is thread used in stitching. Then we also have the OS or the operating sponge. Operating sponge is used in wiping the blood or drainage on the area to maintain cleanliness. Next, on the bottom part, we have the basin. Basin is used to place the placenta. Then we have the ovum forceps. Ovum forceps is used in deep cleaning of the uterus, also in removing blood clot and placental fragment. After that is we have the two-alice. Two-alice is used to grip the cut edges of the perineum as well as to align the layers of the skin. Then we also have the suction bulb. Suction bulb is used for the baby's mouth and nose. This is to remove blood and clear the airway so that we can promote promote comfort to the baby as well as easy breathing. So make sure that we first use it on the mouth, then to the nose. In the mouth, we have at least no more than 4 suctions, and on the nose, we have at least 2 to 3 suctions. After that is we need to assess for the fetal and placental delivery. We're going to use this for the first clamp and this and cut. Then next is we're going to take note of the time of the fetal delivery as well as the placental delivery and identify the type of placenta. Baby out 5:25. Then next is we're going to take the placenta out 5:26. The 2 types of placenta, we have the Duncan side and the Scholl side. The Duncan is the dirty side wherein it is on the mother side, and the Scholl is the shiny side on the fetal side. After that is we're going to assess for the episiotomy. But before that, we're going to prepare for the anesthesia. The anesthesia that we're going to use is, the generic name is the lidocaine, and the brand name is Silocaine or Lignocaine. Then we're also going to prepare the suture. And then after that is we're going to prepare our ovum forceps and do perineal cleaning. To maintain hygiene and promote healing. After that is we are going to discard all the sharps in the sharps bin. This is to prevent injury as well as prevent cross-contamination. Next is we're going to wash all the instruments that we use, including the CaliPad. This is initial decontamination to reduce the risk of infection before sterilization. And next is we're going to monitor for our patient's vital signs, the pulse rate, heart rate, temperature, and the BP. And we also need to take note of the fundus, make sure that it is firm and on the midline. This indicates that the uterus is contracting well. So simply, it has a healthy uterine condition. Then we also need to monitor of its leukia. We have 3 normal findings: the leukia rubra, leukia serosa, and leukia alba. The most normal is the leukia rubra. It's bright red in color in days 1 to 4. And then make sure that we monitor it every 15 minutes, about 1 to 2 hours. And then lastly is we're going to report all the abnormalities and unusualities to the rightful one, to the doctor and the physician, because early detection saves life. Thank you.